This is our critical examination of transcutaneous electrical nerve stimulation machines. Transcutaneous electrical nerve stimulation machines, or TENS machines, are a product that delivers alternating currents through cutaneous electrodes. The product is low cost and widely available for use. They are easy to operate, which allows many individuals to use them at home. TENS machines claim to be able to increase strength, relieve pain, and decrease recovery time after an injury. They are mostly used for physical preparation, muscular recovery, and pain treatment in sports, fitness, and everyday life. It is marketed for various conditions including chronic pain, post-operative pain, and musculoskeletal disorders. With claims of research-backed benefits such as reduced pain intensity, improved function, and decreased reliance on medication, several studies have been conducted to assess transcutaneous electrical nerve stimulation function in providing relief to patients for debilitating symptoms of pain. Several studies have been conducted to assess transcutaneous electrical nerve stimulation function in providing relief to patients with debilitating symptoms of pain. Some studies show TENS being an effective tool in aiding patients with their chronic pain, overall improving their daily function, while others show an indifference to the TENS machine where participants do not necessarily feel negative effects with their pain, but rather no change at all, leading us to believe that there is not enough evidence to say that transcutaneous electrical nerve stimulation machines are worth what they are advertising. We have concluded that due to various limitations and discrepancies in the methodology, further research is necessary to confirm any real benefits for these machines.
Studies did display some strengths for the product transcutaneous electrical nerve stimulation in pain management. One being the mechanistic evidence, as studies consistently demonstrate physiological mechanisms for pain reduction through peripheral and central pathways, as well as meta-analysis or large-scale reviews showing moderate effects for pain relief across diverse conditions, supporting its general efficacy. A study conducted on spinal cord injury patients using low-frequency transcutaneous electrical nerve stimulation for treatment of neuropathic pain. This study has validity in the sample population as the participants were kept close in age. When long-term effects of TENS were assessed in patients with chronic pain, positive results were found with respect to being able to resume work, home, and social activities, increased activity level and pain management, and lower use of drugs and other treatments. This proves that some benefits may be found in improving overall quality of life using TENS machines, alongside other treatments during injury rehabilitation. A study done on spinal cord injury patients with neuropathic pain showed strengths in their methodology. The application of the transcutaneous electrical nerve stimulation was applied by the same psychiatrist within 4 hours. This eliminates variability in the application and keeps it as consistent as possible, which helps to eliminate confounding variables within the study. In this study, they also had the participants randomly assorted in the placebo group and the intervention group. Having this placebo group where the participants are put through the exact same intervention with only a sham TENS allows them to be able to see if there is any form of a causational relationship between the pain relief and the TENS intervention. A Mann-Whitney U-test was performed to determine that P was less than or equal to 0.05 and therefore statistically significant.
Multiple limitations found across different studies that could impact the validity and accuracy of the product. Firstly, there were methodological issues, as many studies suffered from small sample sizes, inadequate blinding, and inconsistent reporting of adverse events. Furthermore, there was a high risk of bias noted in trials with fewer than 200 participants per arm. Concurrent use of treatments also often contaminates results. That, with the lack of heterogeneity because of combined data from different pain syndromes, complicates conclusions due to variability in protocols and patient populations. Finally, publication bias could come into play as positive findings may be overrepresented in the literature. while negative or inconclusive results are often underreported. A study done by the Journal of Rehabilitation Research and Development on spinal cord injury patients shows TENS working in 29% of participants with high-frequency stimulation and 38% of participants with low-frequency stimulation. This study, however, has a few limitations. The participants would treat themselves at home, which could cause variability in application, which may influence the effectiveness of transcutaneous electrical nerve stimulation machine. The age range was 18 to 70 years old, which can cause a lot of variability biologically, especially in women where menopause can come into play. The sample size was also small. This study started with 33 participants and ended up with 18, as 15 dropped out or could not complete the study. With such a small sample size, each participant's data sways the results much more than it would in a larger sample. This study also did not have a placebo group. There was a within-subject comparison for before and after the TENS, but the lack of a placebo trial makes it harder to draw any solid causational relation.
While there is evidence supporting the efficacy of TENS for short-term pain relief, the overall quality of research is mixed due to the methodological flaws and variability in study designs. Claims about its broader benefits, for example, improved function or reduced medication use, require further robust investigation with larger sample sizes to reduce risk of bias, longer study length to look at more long-term effects, and better controlled trials. Research now suggests an inconclusive result of transcutaneous electrical nerve stimulation's effectiveness in relieving pain, as reviews share mixed opinions in its function. Further research should be done with a consideration of how TENS affects participants experiencing different forms of pain, for example, chronic back pain versus spinal cord injury pain, how the pain impacts their daily life, and if there is a favored frequency to treat these pains. Based on mixed results, it cannot be concluded that TENS has any positive or negative effects on pain management. However, with proper investigation in its effects and possible modifications to the function of TENS, it could potentially be a promising source of pain relief for individuals. This was our reference slide to conduct all of these investigations, and we wish you a good day.